A glimmer of hope in the fight against leukemia. The importance of blood donation. Leukemia is the most commonly diagnosed cancer in children, accounting for 1 out of every 3 pediatric cancers diagnosed annually. Approximately 75% of leukemia cases in children are of the acute type, which involves rapidly multiplying cells. However, acute leukemia is not limited to children alone. It is also frequently diagnosed in patients between the ages of 16 and 25. Furthermore, acute leukemia can occur in individuals ranging from the mentioned age group up to the age of 49. On the other hand, chronic leukemia, characterized by slow-growing cells, is more common in older adults. Raising public awareness about leukemia, which tends to affect children and young people, is of utmost importance. Content. What is leukemia? Diagnosing leukemia. Treatment methods used in the treatment of leukemia. Challenges for children diagnosed with leukemia. Support and assistance options. What is leukemia? To answer the question what is leukemia in the most comprehensive way, it is an abnormal proliferation of cells that occurs in the blood-forming tissues of the body, including the bone marrow and lymphatic system. Diagnosing leukemia. There are many symptoms of leukemia, and they may vary depending on the type of leukemia. However, the following are the most typical signs and symptoms of leukemia. Fever or chills, corroding, continuous fatigue, weakness, frequent and serious infections, weight losses, swollen lymph nodes, especially in the armpits and groin, liver and spleen enlargement, bleeding and bruising easily in a part of the body, tiny red spots in the skin, petechia, recurrent nosebleeds, excessive sweating, especially at night, bone pain or tenderness. An individual experiencing the symptoms listed above should seek an expert doctor's opinion, as it may provide an opportunity for early diagnosis. The following procedures are commonly performed to facilitate the diagnosis process. Physical examination. During the physical examination, the doctor assesses whether the patient exhibits signs of anemia, such as pale skin, as well as the presence of swollen lymph nodes and enlargement of the liver and spleen, which are potential indicators of leukemia. Blood test. The diagnosis of leukemia can also be determined based on the result of blood test. If there is an abnormal increase in platelet values, as well as abnormal levels of red or white blood cells, it can be indicative of leukemia. However, relying solely on blood tests may be insufficient to detect certain types of leukemia, as some leukemia cells may remain localized in the bone marrow and may not circulate in the blood. Bone marrow test. To definitively confirm the presence of leukemia, doctors may request a bone marrow test. The procedure for this test involves using a thin, long syringe to extract the sample of bone marrow from the patient's hip. The extracted sample is then sent to the laboratory, where tests are conducted to analyze its characteristics and determine if leukemia is present. The results of this test also provide the doctors with valuable information about the appropriate treatment approach in case the individual is diagnosed with leukemia. Treatment methods used in the treatment of leukemia. Chemotherapy. Chemotherapy is not only commonly used in the treatment of leukemia, but also in the treatment of almost all types of cancer. The treatment approach for leukemia depends on the specific type of cancer, and it may involve the use of a single chemotherapy drug or a combination of multiple drugs. These drugs can be administered to the patient orally in tablet form or through intravenous injection. Targeted therapy. In this treatment approach, instead of damaging healthy cells like in chemotherapy, the aim is to investigate the factors that trigger cancer and try to block or inhibit these factors, thereby attempting to kill tumor cells. These factors can be specific genes, proteins, tissue environments, or growth factors. The decision regarding which factors affecting cancer needs to be blocked or, in other words, halted, will be determined by the doctor through a series of tests. Again, certain medications are used. Radiation therapy. The aim of using X-ray radiation is to kill cancer cells and prevent their growth and proliferation. In this approach, depending on the distribution of leukemia, radiation beams can be directed to specific points or applied to the entire body. Typically, this treatment approach is administered period to bone marrow transplantation, serving as a preparatory measure for the transplant. It can be considered as a kind of preparation for the transplantation process. Bone marrow transplant. After undergoing intensive chemotherapy and radiation therapy, patients require healthy stem cells. This period, which is particularly challenging in terms of finding a suitable donor, is perhaps the most demanding phase of leukemia treatment. Immunotherapy. Cancer cells produce specific proteins to evade the body's immune system. Immunotherapy, on the other hand, aims to provide treatment by inhibiting these activities of the cells. Modifying immune system cells to fight leukemia cells. Chimeric antigen receptor T-cell therapy is a specialized treatment approach. Unhappily, our valid immune system component, T cells, may not recognize cancerous cells. In this approach, T cells from the body are collected and transferred to a laboratory setting where the receptors on the surface of T cells are genetically modified to recognize leukemia. These modified T cells are then reintroduced into the body with the expectation that they will target leukemia cells and provide the necessary treatment. Clinical research. During leukemia treatment, several yet-to-be-marketed therapeutic approaches can also provide a beneficial impact on leukemia treatment, giving a chance to therapeutic studies that are still in the clinical research phase within the framework of risk-benefit evaluation can contribute to both the positive course of treatment and scientific advancements. Psychological issues. Children and their families can experience significant emotional distress during and after the treatment process. One of the most challenging aspects for families is often the financial burden associated with the treatment. Arranging accommodation near the hospital, traveling, taking time off from work, and dealing with similar issues can be particularly stressful. In this process, the effort of public institutions, organizations, associations, and communities are highly valuable. Children can also become emotionally drained during this period. They may be hesitant to attend school due to the physical changes brought about by the treatment, which may affect their interactions with peers. In such cases, expert assistance may be required, and education on leukemia can be provided in schools to foster more constructive attitudes among children. Receiving support from peers can also have a positive impact on the process. Furthermore, children with leukemia may have anxiety-inducing thoughts, such as the fear of relapse, feeling of resentment toward having to undergo treatment while others not, concern about social exclusion, and worries about their future regarding relationships, marriage, and having children. Leukemia treatment can negatively impact the cognitive abilities that children require throughout their educational journey. These effects can manifest as difficulties in reading and speaking, challenges in writing due to weak motor skills, and impairment in problem-solving and concentration skills. These disadvantages can be attributed to treatment approaches that target the brain and spinal cord. Support and assistance options. LOSEP, Foundation for Children with Leukemia, is a charitable foundation that has earned the admiration of our country and the entire world through its commendable efforts in caring for children with leukemia. To support children and families battling leukemia, You can become a volunteer for a lesson and make donation to the foundation. Additionally, you can provide support to patients fighting leukemia by regularly donating blood and bone marrow, and you can also purchase products sold by families of children with leukemia. You can send your comments by following us on BioinfoStar's social media accounts. See you in the next video. Stay with science!